Hi, have you ever thought of straightening your teeth? Never too late. I'm Dr. Myrna Lazaga here in San Diego. Today we're going to talk about orthodontics, how it works, how is it being done, and how can it. Orthodontics is part of the stuff that we do in a dental office wherein we move teeth so that way we can align your teeth. If there's crowding, we uncrowd it. If there's a tooth that's like sticking out, we can bring it in. So basically, what it does, it helps improve your smile. And not only that, it depends. If your teeth is too far out, it can affect your speech as well. There are a lot of orthodontic treatment available today. One is the traditional braces. The other one is what we call fast braces. There's also Invisalign or clear aligner. And also there are some wherein they even have the brackets colored or metal, and also clear ones that we can use. It is recommended that children at the age of 7, they should be assessed for orthodontic evaluation. The reason behind is the sooner you get it assessed, like let's say for example, it will show around 7 where the teeth are, if there is no spacing for the grown-up teeth to come in, there are some early treatment that we can to create a space for the grown-up teeth. If there's, because you can already tell if there will be a crowding, because the grown-up teeth is twice bigger than the baby teeth. The advantages of early orthodontic for kids is when we do have kids that are being treated at an early age, we can intercept by expanding the jaw or to create spaces to avoid those dreaded extractions, because sometimes with the teeth comes out faster than their jawbone growth. In that scenario, we can do an interception wherein we can create space for the grown-up teeth. The orthodontic treatment for teens and adults are big difference. First, with adults, pretty much the growth pattern is already done. The teenager, you can enhance treatment of orthodontics while there is still that the jawbone is growing, or the pattern, growth pattern of the jaw. You can help that with also creating space for the teeth, so that way to avoid extractions or taking out teeth in order to fit in the mouth. There are more options for the kids or younger adult, like the expansion of the jawbone. While the adult, there are some that's kind of limited already, because the growth process has already done. The most common treatment, orthodontic treatment for adults, are braces. In my office, I use fast braces for adults, and that we have to make sure that the roots are fully formed before we do that, because the fast braces, it cuts the time. Adults also, some it depends on the health of their bone that supports their jaw or their teeth, and also the gums, and they make sure, yes, that they are nice and healthy. I've noticed that people with diabetes, their gums usually get infected commonly. Yes, we just have to make sure that when you're an adult, that you don't have any problem with gum infection before starting ortho. Headgear is an obsolete treatment option. There are a lot more better options that the headgear was used, or in these cases wherein we have mouth like a mouth guard that we put on the patients, and they only wear it at, like an, yes, it is actually, yeah, an appliance that the um, patient use in order to function like a headgear. Those appliances necessary when the cases wherein they have to move the jaw forward, or if the also the bite, and also when there is skeletal description. The cost factor in orthodontic treatment, it depends on how the complexity of the mouth is. Like, is it as far as their bite is? Is there tooth that's rotated? Is there tooth that's sticking out too far out, or too crowding? Of course, with that case, we have to take it more time to consider. And then the treatment time is going to be also extended. Yes, and also, say for example, there are some, most of the time wherein the eye tooth in the top one is a common, where it gets stuck on the gums. Those are, it depends on how is it. We might need to do surgery on that to bring it down. Those are the kind of factors that can affect of the orthodontic. There is always ways that we can help you to make it more affordable. In our office, we help our patient to make it affordable. Say, for example, if what we would require them to make a down payment, and then whatever remaining from the treatment, they can make a monthly payment on that up to the months where the treatment usually takes. Let's say, for example, if it's going to take 1 year, we can divide it into monthly for a year. That's how we can make it affordable. And also, we work with some financing institution that can help you with that. Like, say, for example, there's even no interest for finance, like care credit. And basically, our office will always work for you on that, so you can get the treatment. You can avail the treatment. First thing first that the patient should consider to provide them with orthodontic treatment is they must have the trust on the doctor. That's very important. And that also that the doctor has the experience in treating that, and in that they would be able to explain to them. Um, and then, in my case, I would always ask the patient, what are the expectations? Now, if their expectation is the one that I'll be able to meet, I would gladly do it. But if it's something that they have the expectation that I couldn't meet, then I would refer them. If you have any questions regarding that, we also offer free consultation for ortho evaluation in the office. Please don't hesitate to call us to set up an appointment. Advanced dental technique improve in a lot of ways to make your treatment time faster. Like, for example, in my case, I use fast braces where it cuts the time in half. And also the advanced technique, sometimes it's also compliance sensitive. So we would need the cooperation of the patient um, to come in for their scheduled appointment for follow-up, because it's really important. Like, say, for example, in some cases wherein patient did not show up on time, it takes longer. But if they are consistent, and it is much easier. And also, the hygiene is very important, uh, because you can have all the technique you have, if the patient is not doing well in taking good care of their teeth, they can easily build up in there. And then I have to take those buildup in there because I cannot close the space when buildup is in between. And then other than that, I always tell my patient that hygiene is very important because I'd rather have them crooked teeth and healthy ones rather than straightened teeth but rotten ones. This is Dr. Lazaga. You can call our office at 619-477-0570. If you need more questions, we do offer free consultation for orthodontics. Thank you.